Good afternoon, evening, wherever you are. Welcome to our seminar with Dr. Rohit Aggarwal on the MENT project study. My name is Lynn Wilson, and I'm the Vice President and Director of Patient-Led Research for Myositis Support and Understanding. I'm joined by Manuel Lubnes, who is the Chief Science Officer for our organization. And probably from many other webinars, Jessica Taylor, who's our Director of Operations. The gentleman I'm about to introduce probably needs no introduction, and I'm not going to mention every one of his credentials because it would probably take the whole session. But for those of you who don't know Dr. Aggarwal, he's a professor of medicine at the University of Pittsburgh. He's also medical director of the Arthritis and Autoimmune Center there at the Medical Center at University of Pittsburgh, and also the co-director of the Myositis Center. In all of that, he's also, and I'll say this because I think this is probably the most important thing for me, he's a true champion for the myositis community and all that he does for building awareness and his educational efforts, one of which you probably are very familiar with, which is the Myositis 101 series that is out on YouTube. The other thing that he has done is he's, for those of you who probably see a familiar face there, he was a previous president of the Medical Board Advisory Board for TMA. So Dr. Aggarwal, with that, I'll turn it over to you. I think you have somebody to introduce also.
Yeah, I just wanted to introduce Tanya Chandra, who started as a myositis fellow at UPMC just recently in this July. And Tanya has really actually impressed every one of us within the last few weeks. But basically, this is also an effort to improve the access problem for myositis patients so that we can train more doctors into myositis, and then those doctors obviously then can help the patients and promote the research that can help the myositis community overall. Welcome everyone to this talk. I'm going to share my screen, perhaps here, if you can see the trial. Are you able to see the screen?
Yes.
Okay. Let's see here. The trial I'm going to be talking about today is MINT trial, or myositis ILD, or ILD, as you know, is interstitial lung disease, or also known as pulmonary fibrosis. Nintedanib, which is a drug it is an anti-fibrotic drug, which means it cuts down the scarring and has been an FDA approved drug for various other indications. So this is called myositis ILD Nintedanib trial, or in short, MINT trial. Let me first begin, without going to the details of the trial, let me explain you why there is a need of such trial. So first of all, this is a first of its kind decentralized trial. A decentralized trial means it's a remote trial. That means almost all, if not all, operations of the trial will be done remotely or virtually, which means it's possible for patients to enroll in the trial, get the participation in the trial, get the drug in the trial, and get all the interventions of the trial remotely from the comfort of their home anywhere in United States. And that's first of its kind in rheumatology and pulmonary world that we are trying to achieve. And that's why I have a quote here: if it doesn't happen, make it happen. Sorry for that, happens is twice. But if it doesn't happen, make it happen is a quote for this trial, basically, because it has never happened and we are trying to make it happen. It's incredibly difficult, but we are hoping to do this so that it will help patients with rare diseases. As you may all aware of, rare disease such as myositis has it's very difficult for the patients to get access to care. But also, if they want to participate in research, it is very difficult for them to participate in research. In most cases, it requires travel to a study center, which sometimes may be hours away from their home, requires the whole day or sometimes 2 days of effort back and forth almost every month, makes it incredibly difficult for those patients to participate in research and clinical trial. So what this trial does, it sort of flips it around, saying instead of patient coming to the center, we will go to the patient's home, because we need to help our patients by going to their home and doing a studies like this so that we can understand whether this drug works or not work. And this model then can be applied to many other studies and clinical trial in future. So that's our effort. That's the need, because many patients with myositis told us, well, your center is too far from us. I'm in California, and there is the closest center that you have is about 500 miles from me. Now that's not possible. And in a study, we can, even if we have 50 centers, even then we cannot service all the patients in the United States. But in this model, in a remote model, they could be anywhere in US, and we can help them and enroll them in the study and have them participate in the study. The other problem that we have seen in the trial is inclusion. So we have very little representation from African American patients, from Hispanic patients. There's a language barrier. So we have tried to overcome those barriers as well in this study, because in this study we will try to get patients who have generally been underrepresented in research areas and clinical trial. So we are also trying to bridge that gap as well through this study. And there are various other aspects that are more friendly for the patient. For example, patient doesn't have to go for a blood draw. A nurse will go to patient's home and get their blood draw from their home. Many things that I will talk about in this trial that are done keeping specifically patient's interest in mind. So what is the advantage overall for us to do a centralized trial? The main thing is we get a faster recruitment, because any patients from anywhere in the US can participate. We expand the geographic reach. Normally in a clinical trial, a patient who's only about 100 to 200 mile radius from a study center can participate. But in this type of trial, they can be from anywhere. It increases the diversity of and equity of trial participant with respect to race, language, socioeconomic status, and so on. It also significantly decreases the burden on our patients in terms of travel time and cost. It's more patient-centric because we are going to patients to get their data, not the patients coming to us. And also, because we are monitoring them from their home, we can monitor them actually far better, because in a normal clinical trial, in a traditional clinical trial, they come to a center for every month. So we only get a data once a month. But in this type of trial, we are getting data daily, weekly from the patients with conveniently through various monitoring devices. Now, there are some challenges of such a trial. Digital literacy is a challenge. If some patients don't use mobile phones or don't have internet at home, that could be a challenge. Some patients may feel overburdened with the monitoring device, and then IT issues could come up as well. So there are some challenges as well. So in this trial, we have 15 sites all across the United States. These sites will only enroll patients from in and around their area. But then there is one remote site, which is University of Pittsburgh, that has capacity to enroll patients from anywhere in the United States. So what's the primary aim of the MINT trial? The primary aim of the MINT trial is to use this drug called Nintedanib, or Ofev. It's a trade name. It's been approved for interstitial lung disease, pulmonary fibrosis of progressive nature in patients with autoimmune diseases, as well as patients with scleroderma. And technically, patients with myositis could actually get this drug as well, because myositis is one of the autoimmune diseases for which this drug is approved. But the problem is we have very little data about myositis patient population with this drug use. We don't have much of the data of effect. We don't have data on safety and tolerability. So this trial we are doing to get the data specifically on myositis ILD or myositis pulmonary fibrosis, so that we can understand, does this drug work or does not work? Does it safe or not? Is it tolerable or not? And that's why we're doing this trial. The important part is this drug is an anti-fibrotic drug. It's not an immune suppressive drug. So that means it will be given in addition to your current standard of care treatment that your doctor is giving. So from my standpoint, there is not any downside of enrolling in this trial. You will be on your medication as per your doctors. You will either get the drug or not get the drug for 12 weeks, and then everybody will get the drug for next 12 weeks. So in terms of the patient's standpoint, we're not stopping your current treatment. We're just adding on another line of treatment to see if you can get benefit, more benefit than what your current treatment is giving you. So can we get better improvement? Can we get better, less shortness of breath, better ability to walk without having difficulty in breathing and so on? Can we decrease the oxygen requirements and things like that? Can we improve the pulmonary function study? Can we improve the scarring that we see on the lungs on the CT scan? And there are many other secondary objectives that I will not go in details with that will help to understand myositis interstitial lung disease overall. And I said previously, half the patient will get drug and half will not for 12 weeks, but then everybody will get the drug for next 12 weeks. The total trial duration is about 24 weeks. Now, this is a very important slide I want to share with you because it tells the study flow. As I said, there are two ways the patients can come in. One, they can come in through the center, which is about 100, 200 mile radius of 15 centers we have across the country. But more importantly, patients can come in from anywhere in US through a remote center of University of Pittsburgh. If you come in through a remote center, we call it a decentralized or remote site. And if you come in, first thing we do is we evaluate you to see, we talk to your local doctor, because your doctor is still very important to the study. So we're not just going to enroll you in the study. We'll first talk to your doctor. We'll first talk to you. We'll review your medical records. If all the three things line up, what you're telling us, what your doctor is telling us, and what your medical records tells us, if all those things align that you would benefit from enrolling in the study, only then you go to the step 2, which is the screening. And if you pass the screening, then you are enrolled. Once you enrolled in the study, all data collection for you for decentralized is all collected remotely through patient's home. How does that happen? What will happen is we will send you devices, and I'll show you how that device will look like. We'll send you a tablet, we'll send you blood pressure monitoring, we'll send you a pulse ox, we'll send you a watch that measures activity, and we'll basically monitor all your data on a routine basis from your home, including your PFT or spirometry test will be done at home by you under the guidance of pulmonary function test or PFT technician who will guide you through Zoom call and will walk you through that test at home. So all the things will be done remotely. We'll also get a CT scan, a regular PFT, which is where you go to a clinic and get a PFT and a blood collection. And let me explain you how that happens. For HRCT, obviously, we can't do at home. So what we will do is we will identify the closest center to your home where HRCT is available, nearest hospital perhaps, or some other facility. And we will arrange or schedule, after talking to you, an HRCT for you. We'll arrange the PFT or spirometry for you, also again, nearby hospital or center. Those things we'll arrange for you. You just go there, get the test done, and go home, and we'll get the data and we'll talk to you about your data. But the blood collection is important as well because of monitoring labs. We will monitor all the labs throughout the study. But the blood collection, we will send a nurse to your home, and the nurse will actually go make sure you're comfortable, make sure everything is collected, and then at the end of that visit, we'll collect the blood and send the blood to University of Pittsburgh. We'll run your labs and we'll share your labs with you. Importantly, how the drug will be delivered. The drug will be delivered through central pharmacy, through a courier service. They will call you, set up, make sure that you're ready to receive the drug. Then they will tell you when the drug is coming. The drug will be shipped to you, and then the coordinator will then call you once you have the drug, then when you can start taking the drug on a daily basis. While at the end of the study, the leftover drug will be mailed back by you in a previously given envelope or a mailing box that you will receive. Overall compensation for your time and effort is $300 for the whole study. Again, this is not anything to do with the time and effort that you're helping in the study, but also it's a way to say thanks basically for participating in the study. Now, who can participate in the study? One, you have to have either the diagnosis of myositis, or if you don't have a diagnosis of myositis, you could have one of the myositis antibodies. And there are several myositis antibodies that are possible, and they're called myositis antibodies because those are seen in myositis patients. You may not know your antibody, but you can talk to your doctor and see which of the myositis antibody you had. So you will get a knowledge about which autoantibody you have. I'm pretty sure your doctor would have run a myositis antibody on you. The second thing, actually, perhaps the first most important thing, you have to be an adult and living in the United States to participate in the study. You have to speak English or Spanish. We have made a lot of effort to include our Hispanic patient population. So we have made a lot of effort to translate everything in Spanish, including the instructions, including every trial manual. Everything is also available in Spanish for our patient population. You have to have an interstitial lung disease because that's how this trial is designed. The anti-fibrotic drug is given to cut down the fibrosis of interstitial lung disease. So that's why you have to have interstitial lung disease of a progressive nature. Then you also cannot have a very severe lung disease like FVC or forced vital capacity of less than 40, and you can't have a very mild lung disease. But importantly, you also will undergo a screening for home spirometry. Now, what is home spirometry? It's a device like this big that is used to evaluate lung function at your home. And you don't have to worry about it because somebody will do a Zoom call and walk you through how to do it. Once you know how to do it, it should not be a problem for you to do it. But if you need any assistance during the study, they can Zoom back in and give you the guidance or answer your questions and so on. You must be on the stable medication, standard of care therapy. You should be willing to perform all the study procedures. Men and women of reproductive potential must agree to use reliable methods of birth control. Standard of care immune suppression, almost all standard of care immune suppression is allowed. Typically, in this trial, we request maximum of 2 standard of care immune suppression. And then, we can obviously, you don't have to worry about these criteria. We can review your records and tell you whether you would be would you be eligible for the study or not. This is what I was talking about, the trial, the key component, the study components, how you're going to get a bag like this, which will have a tablet, which is seen on your screen. You'll have a blood pressure monitor, as you've seen on the screen. You will have an oxygen saturation meter, and you will have a home PFT or home spirometry. This will all be given to you in a bag with an instruction. But again, a coordinator will walk you through all of these things. We'll actually do a Zoom call with you to make sure you understand how to use these instruments so that you don't have to struggle about reading all the instructions, but instructions will still be provided to you. Blood component, I think I already talked to you. There are various ways we're going to get blood from the patient's home. The most important is that the mobile nurse will go to your home and get the blood collection. But if you prefer to get a blood collection from a nearby center, or if you prefer to get a blood collection from a local clinical site, that's also possible. This is just a home spirometry, which is the home PFT that I told you that you will be trained on, and then you will do it on a regular basis to get the data so that we can monitor your lung function study much better than what we do every 3 months in a way, because this will give us data every week. And this is just a small video to show how that lung function study works. And I would love to show this video for those of you who have had the lung function study to show you how nicely this home spirometry works, just to give you a demonstration. But again, I would not have the patients worry about it because we will have a technician who will walk the patient through this as well. But it's a short 5-minute video that will give you an idea.
I'm going to do a quick demonstration.
Are you able to hear it?
Perform spirometry in the patient's home.
Yes, we can hear it.
Measurement request will be sent from the portal, and it'll be sent right to the patient's go home patient tablet. And when they receive the measurement request, it will come in. The device will begin to beep and blink. There will be a border around the outside, which is purple. And then all the patient has to do is touch the mail button. It will launch a screen and it'll tell the patient to launch the app. And then the Go Spiro app will open and the avatar will coach them through the full spirometry effort. That data then will be automatically transferred to the MTI Care portal. And then they can view the doctor, the technician, the respiratory therapist can view the data. You can see the device beeps and blinks. All the patient needs to do is hit the mail button, and they have three options. Launch the app, snooze, or skip the measurement. If we launch the app, you'll see that the application loads and Lisa takes you through testing.
Hello, my name is Lisa. If I have coached you through this measurement before, you can skip the remaining pre-test instructions by touching the Proceed button on the screen. I am going to guide you through a measurement of your lung function that will require you to take a really, really deep breath and then blow out as hard and as fast as you can for at least 6 seconds. I will be here to guide you through the entire procedure. You will need to sit straight up in your chair with your feet flat against the floor. You will then put the nose clip on and the mouthpiece in your mouth behind your teeth and get a good seal around the mouthpiece with your lips. Make sure your tongue is not blocking the hole in the mouthpiece. Then you will breathe quietly by taking normal breaths. After a few breaths, you will be told to breathe out and then quickly take a deep breath. As deep as you possibly can. As soon as your lungs are full and don't hold your breath, blast out as hard and as fast as you can and keep blowing out for at least 6 seconds. I will coach you through each step and will let you know when the time is up. Then you will take a deep breath in, as deep as you can, and then take the mouthpiece out of your mouth. Just relax and listen to me as I coach you through the measurement. We need to make certain that the results are reliable, and depending on each result, I may have to ask you to perform more measurements. I will let you know after each measurement if another one is required. Press the purple button on the spirometer and the blinking light next to the button should be lit without blinking. If it isn't, your spirometer may not be connected to the program. If it turns off, the battery may need to be charged. Are you ready? Okay, put the nose clip on. Put the mouthpiece in your mouth behind your teeth and get a good seal. Breathe quietly, nice and easy. Just in and out. Just in and out. Okay, breathe out. Huge breath and blast out hard. You are almost done. Keep blowing.
I stopped a little early just to hear what the avatar has to say.
Let's see if we need to repeat the measurement. You stopped exhaling while there was still air leaving your lungs. You need to blow out a little longer. We need to perform another measurement.
You can see here the data shows, and this green cloud and arrow represents that the data has already been transmitted to the MTI Care portal, our cloud-based application, so that a technician or a doctor could actually be reviewing the data. I'm going to toggle over to the MTI Care portal. And we're going to go to the patient's record. And you can see here, this is the test we just performed. You can see that loop. And you can see all the quality parameters. You can see ELFE, which stands for end of forced exhalation.
So I'm going to stop it here and
That means they did not meet the pledge.
Go to the next slide here. In addition, you will also, so I hope you see that how easy is it, but it's not the only thing, because this is an avatar coaching you to do a pulmonary function study at home or PFT at home, but they're actually going to be live in person as well with you through Zoom that will also coach you through. So there will be two people. One is the avatar, and then the coach will also guide you through that. So again, I don't want the patients to worry about the nitty-gritties of it, because we will explain it well to the patients. Patient will also get a watch, which is a physical activity monitor that will help us to collect the data about their physical activity, because when patients have lung disease, their physical or myositis, their physical activity or ability or function goes down. And if they get better, their physical activity or function improves. And we also will developing a website, which is not yet launched, but we'll develop a website to kind of have a direct patient experience as well, through which the patient get all the information about the study and so on. But currently, patient can get information through directly by emailing us or through clinicaltrial.gov as well. So I will stop and see if anyone has any questions on this.
Yes, thank you. Okay, these are the 5 questions that came in on our registration form. And I'll just go through them because just to reinforce the answer. How long is the study?
So the total study duration is 8 weeks, 4 to 8 weeks of screening, followed by 24 weeks of the study participation. So it depends on if you include the screening, it's about 32 weeks. If you don't include the screening period, then it's about 24 weeks.
Okay. You've talked about the pros. What about the cons of participation?
Yeah, that's a very good question. So actually, the only con that anytime you join any clinical trial, the con is when you get an additional drug, there could be side effect of those drugs. Like any drug has a side effect. So if you happen to have those side effects, that's the only con really from my standpoint to participate in the study. So that's the main important thing. So what are the side effects of the drug? The main side effect of the drug is diarrhea. Then sometimes patient can also have liver function abnormality. That's why we will be monitoring the patient's blood throughout the study. So if there is liver function abnormality, we can quickly intervene or decrease the dose or hold the dose and do anything, and and we can manage that very easily. If the patient has diarrhea, then also we have an algorithm on how to manage the diarrhea part of it. Those are 2 main symptoms that I will talk to you about in terms of adverse event that the patient could have. There are other small adverse event that I will not discuss in this call right now, but we can discuss in details with the patient. The other con is that you could get the drug or get the placebo. So you for 12 weeks, you could get the placebo or the drug, but then after 12 weeks, you will get the drug for the next 12 weeks. So those are the 2 cons of participating in the study. Perhaps other cons would be, your time involvement, your commitment, doing questionnaires, somebody coming to your home and drawing your labs. These are also could be considered as minor cons of the study.
Thanks. Okay. What if your lungs are stable currently?
That's a great question. If your lungs are rock stable, that means it hasn't really changed in the last 3-4 years, then I think it may be less important for you to join the study. But even in those patients, if they are even slowly declining, sometimes stable could mean slow decline. So the stable is a very difficult word to understand. I think it depends on how your lung function. Is it slowly declining and that's why they have been called stable or not? Sometimes I will say I see patients who have stable lung disease, who quote unquote stable lung disease, but if I compare their PFT from 3 years ago to now, they have declined, So sometimes stable might not all patients are truly stable when they're called stable. So I would still advise you to get evaluated. But if somebody is truly stable and doing great, may not be the good idea to join the study.
Thanks. Now there's a couple of just general questions, and then after we finish that, we'll just open it up to the audience. This question is about being on prednisone a few years. I developed symptoms similar to the weakness in myositis in thighs and arm. I get myopathy when I take any steroid at all. If I'm severe and need ER, what should I get instead of steroids to calm down a flare? Is there any option?
Well, I think this is more in the context of not in context of the study, but if you have a flare and you need to go to an ER, I think the only advantage of steroid is it works quickly, but then it can cause myopathy and other side effects. So sometimes what we recommend is still steroid for a severe flare, but then we taper it off quickly by adding another drug that will help you to prevent those flares again. So that steroids still be an answer, but perhaps only for a short period. and add another drug, which would be decided by your doctor to help you for your myositis or ILD.
Thanks. Now, the last one doesn't really ask a question, so I'm going to find out if Andrew Cohen is in the audience and he can maybe help us out with this. If you're out there, Andrew, I'm going to read your question, and if you could unmute yourself, maybe you could give us a little bit more information about what you were going to ask. Andrew says, I have a current diagnosis of anti-synthetase syndrome and ILD from the anti-Jo1 and autoantibody. I treat it with rituximab infusions every 4 months and 3,000 milligrams a day of Cellcept. And I'm not sure what his question is on that.
Sure.
Is that standard?
Is Andrew
treatment?
here? Maybe you can ask the question.
Andrew is here. He, I know that because he asked another question in our Q&A. So let's give him a second to probably type.
Yeah, but seems like if Andrew is asking whether he could be could participate in the study, I think absolutely yes, because he has the right disease, he's on the right drugs, and he could easily participate in the study. But obviously, we have to see his records in terms of how his lung function study is, how is his CT scan been. So some of those details, but based on what he's just telling us, he could qualify if we have more details.
That was a perfect answer. Thank you. Okay, so if there's no more, we do have a couple in the in the Q&A, and
I want to also emphasize one more thing. If anybody wants to participate in the study, the better, rather than you figuring out whether you could or could not participate, is better to send us an email. That way we can tell you whether you could or not participate, rather than you trying to figure out, because it's sometimes difficult for patients to understand what criteria would they meet or not. The main thing to remember is you have a lung disease, interstitial lung disease, and you have either a clinical diagnosis of myositis or you have an autoantibody with myositis. Those two conditions are met, then we can evaluate to see if you would meet the criteria or not.
okay, so going to our Q&A, we've got one question here. Is any chance this is open for patients in Canada?
Yeah, we debated a lot about it opening to patients with Canada, and at this point, it's not open to patients in Canada. I had a patient who asked me that he has residence in US as well. And I said, then that probably become a possibility, but normally we won't enroll patients from Canada unless that changes in next year or so. Currently, it's not allowed, and it's nothing to do with anything wrong with Canada or anything. It's just logistically difficult to run a study in more than one country, so we decided to be sort of against it.
And back to Andrew, but this is just more or less a statement, not really a question, but for the center at USF, which I'm not sure where that is, it's managed by the rheumatology department or the advanced lung disease department. My rheumatologist is not associated with the USF, but I do see Dr. Patel in the advanced lung department.
Yeah, I don't see this study is not limited to a particular center. So you could be seen by any doctor to participate in this study. That's not a problem.
Okay, thank you, Andrew. That's another good question. I have no more questions in the Q&A, so we'll open it up. We've got plenty of time. We'll open it up to the participants here in the webinar, and if you want to unmute yourself and ask a question, feel free at this moment.
I do have a question for you about the study. Are there any age limits on the study?
No, only age limit is you have to be an adult, age 18 or above.
Perfect.
I have another question that occurs to me. What about if you are close to a local center, but you would like to do the telemedicine? You also have the option to do that?
Yeah, so you have actually the patient have full options. So patient can either do complete remote through University of Pittsburgh, or they can go through the center and still remember, even if they go through the center, they're going through the center mainly to get in the study. But once they're in the study, everything is still done remotely.
Right.
Okay. Well, I really thank you for allowing me to give this talk. MSU, I really want to thank MSU and all our patients who have participated. I would want to leave my email address, and I can type it on the chat or something, that you could reach out to me directly or through MSU if you're interested in knowing more about the study, or you have any questions specific to your disease. We can answer questions specifically to your problem by reviewing your records or talking to your doctor. I really feel patients should not be burdened with figuring out whether they could participate in the study or not. If they have the right disease for a particular trial, it's a responsibility of the centers like us to review the patient's record and tell the patient whether they would be a good fit for the study or not.
Thank you, Dr. Aggarwal. And I'll just reinforce that when we, since we're recording this, when we share it on our YouTube site, we will also include some documents. And one of those documents is a brochure that also has the information to contact Dr. Aggarwal. So if you miss it here, you'll get it later. But if you don't and you need to contact us, you know our number for the most part. Info at myositis, at understandingmyositis.org, or Jessica can put her name in there too in the email chat. Thank you so much, Dr. Aggarwal, for talking to us tonight. And we'll be talking with you again soon, I'm sure. And just a pitch for next year, a very exciting time for Pittsburgh and the University of Pittsburgh. Dr. Aggarwal will be, I believe the center will be hosting the global conference on myositis next year. So that'll be an exciting time too. Love to have you come back again sometime and talk with us, and we'll make sure that we get more information out there to our patients on this very novel excuse me, study.
Thank you.
One last chance. Yeah, one last chance for any comments, questions. I guess that's it. Thank you all so much for joining us tonight.
Bye.
Bye-bye.
Thank you.
Yo.